Our next speaker is Rebecca FICHERA. I think I got it right. Is an accredited practicing dietitian, currently working at the Royal Brisbane and Women's Hospital. Rebecca has over 8 years of experience working with patients and their families in cancer care. Rebecca is passionate about supporting people throughout their cancer journey with evidence-based medical nutritional therapy. And she's going to give us an update on vitamins and malabsorption and general dietary requirements. Thank you.
So, as Meredith said, I'm going to do a general overview of nutrition in NETs and some of the symptoms that can impact your nutrition, but also your vitamin and minerals. Unfortunately, I can't cover everything tonight, so I by no means have covered all the symptoms, but hopefully I've covered the ones that are meaningful to you. So we'll look at the symptoms that can impact your nutrition, what management of those symptoms might involve, will changing your diet help, complementary therapies, vitamins and minerals, and some useful resources. So, a lot of the speakers have already touched on carcinoid syndrome, so we know that it is a cluster of symptoms that may include any of the following, so flushing, diarrhea, abdominal pain and fatigue. And we know that when the NETs produce serotonin, you're at increased risk of vitamin B3 or niacin deficiency. Has everyone heard of that before? Do you know? Yep, okay, good. So I guess the carcinoid syndrome can impact on your nutrition and your micronutrients because of these symptoms. If you've got profuse diarrhea, you might not be absorbing all of your food, you could be losing weight without trying, you might be scared of eating, you might not know what to do. It impacts your quality of life, has been said already, and if you're fatigued, that might impact on your ability or desire to prepare meals, and so, as Jane said, asking for help is really useful. Surgery can certainly impact on your nutrition and vitamin and minerals, and that really depends on where your NET is and where you've had the surgery. I guess to keep in mind the small intestine, its main role is for nutrient absorption, so it makes sense then if you've had any sort of surgery in that area, your nutrients levels might be impacted. The pancreas produces enzymes, among other things, that help us to digest and absorb fat and the fat-soluble vitamins. The large intestine, its main role is for water absorption, and as I've said, removal of any of these parts can also contribute to diarrhea, which can further impact your nutrient absorption. So the treatment itself may, in some people, exacerbate diarrhea. So as many of the speakers have mentioned, the somatostatin analogues, so they're used to block the release of those excess hormones that Amanda was speaking about, which does help to control the symptoms of carcinoid syndrome, but in some people it may contribute to fat malabsorption. And we'll talk about what some of the therapies are for that later on. And then some of the targeted therapies may also cause an acute exacerbation of the diarrhea and abdominal discomfort. And then malnutrition is a big risk in anybody who has cancer. Now, I think when most people hear malnutrition, we think, oh, that couldn't occur with anyone that I know. We think of the skinny, people. But we know now that with the multitude of Australians who are overweight and obese, malnutrition in this cohort is going underdiagnosed. And malnutrition is really when you're eating less than usual, you've lost even a small amount of weight without trying, and you're experiencing some of these other symptoms. So low mood, unintentional weight loss, low energy, muscle wasting, which can impact your quality of life and your strength. You're at increased risk of hospital admissions and infections, and certainly decreased quality of life. So these are all important things that we want to prevent. So then what happens if you have any of these symptoms? And I guess this is my first take-home message, is that before doing anything, it's really important that you discuss your symptoms with the treating team so that the underlying cause of the symptoms can be addressed instead of just treating the symptoms. So, as I said before, the somatostatin analogues are used often to treat the carcinoid syndrome, so they're really important. In some people, as I said, they can actually cause fat malabsorption. In people who have this, you may or may not have overt signs that this is happening. So we usually talk about things like pale stools that might be difficult to flush, they float or have an oily appearance, but not everybody gets these types of symptoms. So sometimes you might be instructed to do a trial of pancreatic enzyme replacement therapy, just to see if that helps. Your doctor is obviously the one prescribing it. Your pharmacist and dietitian can give you some advice around the appropriate timing and dose. It's really important that you still continue to eat fat if you're experiencing fat malabsorption, because fats are a wonderful source of energy for our body, but also those fat-soluble vitamins and minerals as well. So we don't want you cutting them out, we just want you on the right therapy. Again, with profuse diarrhea, hydration is really important, and as was shown in one of the slides before, you can have electrolyte disturbances as well. So you may be instructed to take some medication or rehydration solutions to counteract that. So then will changing your diet help? As Jane said, everyone is a armchair psychiatrist or psychologist. The same goes for dietitians. And I'm sure when people have come forward with advice, again, everybody has got something to say on what might help. The My Herbs app that you spoke about, Jane, is fantastic. I endorse utilising that. But I guess it's really important to remember that diet is an individualised thing, guts are an individualised thing, and what works for one person might not work for you. It's really important as well to recognise what food is for our body. It's fuel, it is what keeps this wonderful machine going, and so any unnecessary, long-term, dramatic changes can have really unpleasant long-term effects as well. And as David has said, people are living longer with their nets, and so really restrictive diets that are unnecessary can cause you issues down the track. So really important to bear that in mind. There are no foods as a blanket when you have a diagnosis of NET that you should avoid. There's not one particular food that we go, oh yeah, you need to stop eating that. And so if you suspect that food is exacerbating your symptoms, obviously you want to explore that, but I really encourage you to start keeping a symptom and food diary, and I'll show you where you can get one from the Unicorn Foundation, and ask your doctor for a referral to a dietitian so that you can work through that process together. Believe it or not, dietitians are not the food police. And one of the things that we're really good at is working with the individual to come up with an eating pattern that might help to control your symptoms if you are someone who does have some food triggers. But we look at you as the whole person, so we want to make sure that you're eating in a way that, one, is enjoyable to you, but secondly, gives your body all of the nutrients that it needs. So if you can't tolerate one particular food, we'll come up with some other suggestions that you might include instead to make sure that you've got a really nice balanced eating pattern. Some simple things that are not restrictive but that may help some people with symptoms of diarrhoea, again depending on the underlying cause, of bloating or abdominal pain, might be to spread your meals across 6 smaller ones instead of 3 big ones. To eat slowly and chew your food thoroughly, not something I'm very good at, but we tend to, the more we chew, it's more digested by the time it gets to our tummy, and then we're not sucking in so much air, which can really help if wind is a problem. And if fatigue is a problem and it's impacting on your ability or desire to prepare meals, then accept help. If you're having a good day, consider cooking and freezing and using the convenience meals that are out there. So just to say that there is limited evidence on the role of dietary changes in certainly the disease trajectory or the disease pathway for NETs. And as I said before, if you do suspect dietary triggers, the best thing that you can do is start keeping a food and symptom diary and then ask for a referral to your dietitian. So the Unicorn Foundation has a lovely food and symptom diary that you can download. You need to keep them for about 2 weeks. They are painful. I'll just let you know that in advance. But food is a funny thing. It's often we will eat something, we get a reaction, and we just automatically think that it's the last thing that we ate. But food's a bit more complex than that. We have meters and meters and meters of gut, so it might take us hours or days to get a response to a food that we've eaten, which is why sometimes it's really hard to pinpoint what you're reacting to. So bear that in mind. You do need to keep it for a couple of weeks to give you and the dietitian some good information to work with, and as specific as is humanly possible. The more information that you can put down on this, the more you guys have to work with. You've got to put your detective hat on a little bit. So saying that, here are some of the things that some people say do trigger. And so I guess what I want you to do is, if you are concerned, I don't want you cutting these things out, but it's just useful to have an awareness while you're completing your food and symptom diary that some of these things might exacerbate symptoms in some people. So the size of the meal, the speed at which you eat, I've mentioned fizzy drinks, highly fatty foods, and that doesn't just mean, fried foods, chips and things like that. All the lovely healthy fats as well are included in this group. Spicy foods can upset a really healthy gut, so they might upset a NET gut. Alcohol, insoluble fibre or roughage, so things like bran and whole grains and fruit and vegetable skins and seeds. Wind-producing foods like legumes and lentils, nuts and seeds, Brussels sprouts. And also amines as well. So these are foods that have been processed or aged. You can see that it's a really broad range of really lovely foods. So again, you don't want to go cutting them out if you don't have to. Again, this is just to have an awareness. Could these things, if you're suspecting food, be some of the triggers? You might think, well, how often do I eat salted fish? And if it's once a year, it's probably not the thing you want to point the finger at, even if you got a bad bout of diarrhea afterwards. Just some things to have an awareness around. I just thought I'd touch on complementary therapies, again under that umbrella of people coming forward with suggestions. Complementary therapies are therapies that are used alongside your conventional medical treatment, and they're things like yoga and massage and meditation and mindfulness and lots of other lovely things. There is evidence that these can certainly assist with management of things like fatigue and pain and the stress and anxiety that Jane has already touched on when dealing with a diagnosis of a chronic illness. And I think you'll find that if you are wanting to explore these things, I really encourage you to discuss them with your treating team, because again, just because it's natural doesn't mean that it's safe. And so that's always, the team's biggest concern is it safe for you to do it? And I think you'll find that everyone is really open with you wanting to explore these complementary therapies. It's just really important that you discuss with your treating team. I will say though that at this stage, there's no evidence that any complementary or alternative therapies alter the, progression of cancer or NETs. So vitamins and minerals. So I've already touched on the fact that the somatostatin analogues may reduce your absorption of fats in some people, and the fat-soluble vitamins, and also B12 as well. Surgery, I said as well, depending on where you have it, can certainly impact on your B12 absorption, as well as other nutrients, depending on where in the small intestine you might have had removed. As I said, your doctor might start you on some pancreatic enzyme replacement therapy, things like Creon, if it's suspected that you're malabsorbing fat, and that usually is enough, if that applies to you, to treat any, concerns around fat-soluble vitamin deficiency. Our body holds on to fat-soluble vitamins for a long time, so it does take a long time for these deficiencies to come into play, so don't feel you need to rush out and request that you get tests done. But it is something, I guess, to think about as people are living longer with NETs, that if you have had really profuse diarrhea for a long, long time, then this might be a discussion that you want to have with your team to see whether is it worthwhile having anything tested for. Not everything's easy to test for, but your team can discuss with you what is available. People with carcinoid syndrome, as I mentioned earlier, are also at risk of vitamin B3 or niacin deficiency. And this is because, let's hope I get this right, this is because tryptophan, which is an amino acid that's found in some of the food that we eat, is a precursor to serotonin. And in NETs that are producing lots and lots of serotonin, there might not be enough tryptophan left to make the niacin. So talking to one of the lovely experienced dietitians down at Peter Mac, she said that as per the evidence-based guidelines, often people are just commenced on a, I guess, preventative or prophylactic vitamin B3 supplement if you have carcinoid syndrome. Again, if you do and you're not on this, I encourage it's something just to talk to your doctor about rather than rushing out to the pharmacy and just starting yourself on some supplementation. Always talk to your team first. My final plug for not making any unnecessary changes to your diet is that apart from all of these things that can impact your nutrition and your vitamin mineral stores, lengthy periods of reduced oral intake or reduced eating, lengthy periods of really restrictive diets are two of the big things that can also reduce your intake of essential nutrients. So again, if you're concerned anything about your diet, then talk to your doctor, and I'd suggest asking for a referral to a dietitian. Useful resources. As Jane said, Dr. Google is most definitely not your friend, but there are some wonderful resources that are readily available. The Unicorn Foundation has the Nutrition and Neuroendocrine Tumours book, which is here tonight. That is a wealth of information. And then there's the Nutrition Education Materials Online website, which is available to everybody, and there's lots of patient resources there that you may find helpful. So in summary, the symptoms of your NET may impact your nutrition, your vitamins and minerals, and your quality of life. It's really essential to discuss all your symptoms that are troubling you with your treating team to see if you want to be looking at identifying the underlying cause. There are no foods that you should automatically avoid, but if you do suspect you're having some food triggers, download the symptom diary, start keeping that, and while you're doing that, ask for a referral to a dietitian. Some NETs and treatments may place you at risk of vitamin deficiencies. It is important to enjoy a wide variety of foods, treat suspected fat malabsorption, and again, talk to your team if you are concerned, and use information sources that you can trust. I just want to say a special thank you to Dr. David Wild and Erin Lang, who is a NET dietitian extraordinaire, who helped me put this presentation together.